Bismillahirrahmanirrahim. Alhamdulillah wassalatu wassalamu ala rasulillah wa ala alihi wa sahbihi wa sallam ajma'in. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is a short talk about the anatomy of the cavernous sinus. The cavernous sinus is located on the either side of the sella turcica and the body of the sphenoid bone, anterior and medial to the vitreous and posterior to the superior orbital fissure. It consists of lacunar framework extradural venous sinuses surrounded by two layers of dura, which receive upper and lower ophthalmic veins and drain to petrosal sinuses, top and bottom. The cavernous sinus, as we said, it is unlike the other dural venous sinuses because it is divided by numerous fibrous septa into a series of small caves, which is where the name is given or derived. The normal lateral wall should be either straight or concave. Here it is a drawing with showing the cavernous sinus. This is the cavernous sinus, and this is the sella turcica containing the pituitary fossa, and this is the sphenoid sinus. The boundaries of the cavernous sinus and the roof, it is fold of dura attached to the anterior and middle clinoid bosses. On the anterior wall, medial end of the superior orbital fissure, and in the posterior wall, vitreous apex, medial wall in this endosteum overlying the body of the sphenoid bone, and the lateral wall dura matter from the edge of the roof to the floor of the middle cranial fossa, and the floor endosteum overlying the base of the greater wing of the sphenoid bone. Here we see the sphenoid sinus, and this is the pituitary gland in the sella turcica, and here this is the cavernous sinus. As we see, this is the any green line, the dura lining the cavernous sinus, and these are the contents of the cranial nerves containing the cavernous sinus, and this is the carotid artery, and this is the sphenoid sinus. This is the medial wall, and this is the vitreous apex, and this is the clinoid process, and this is the middle cranial fossa. The contents of the cavernous sinus can be remembered with mnemonic autumn cat, oculomotor, trochlear, ophthalmic, maxillary, carotid artery, abducent, and trochlear nerves. Different anatomical structure. The largest element running between the plexus is the internal carotid artery, and in its intracavernous portion, which is surrounded by its periarterial sympathetic plexus. The internal carotid artery enters the posterior inferior aspect of the sinus and bends upon itself as the carotid siphon. Cavernous segment. Two branches arises from this segment: meningohypophyseal trunk and inferior lateral trunk. Here, this is the location of the internal carotid artery, as we see in the cavernous sinus. Other different anatomical structures in the cavernous sinus include the cranial nerves, and these are lateral to the internal carotid artery. We have the oculomotor nerve in its uppermost part, and adjacent to it in the lower plane, the trochlear nerve, and in the same plane we have abducent nerve, and lateral to this branch ophthalmic and maxillary branches of the trigeminal nerve. The second branch of the trigeminal nerve is the maxillary, is immediately below the ophthalmic nerve. As we see here, this is the cavernous sinus again, this is the sphenoid sinus, and this is the pituitary internal carotid artery, and this is the oculomotor nerve, and this is the trochlear nerve, and this is the ophthalmic division of the trigeminal nerve, and this is the maxillary division of trigeminal nerve, and the small one, it is the abducent nerve. Again, this is the internal carotid artery, oculomotor nerve, trochlear nerve, ophthalmic division of the trigeminal nerve, maxillary division of the trigeminal nerve, and this is the abducent nerve. Here we see the MRI, and we see the internal carotid artery, and this is the oculomotor nerve, trochlear nerve here, and the trigeminal nerve, ophthalmic and maxillary divisions. And this is the small dot here, this is the abducent nerve. And this is, as we said, this is the cavernous sinus, and this is the enhancing structure is the pituitary gland. Imaging the cavernous sinus is best evaluated with MRI, although the CT scan can recognize and identify some anomalies such as bony destruction. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.